Exercising during pregnancy has a slew of benefits for both you and your baby, as well as your birth and postpartum recovery. But which exercises should be prioritized? Are there things we should avoid wholly? What if you are an athlete or a consistent weightlifter and want to continue throughout your pregnancy? On today's show, we have Gina Conley of Mamastefit with us to talk all about prenatal fitness. Gina gives us an inspiring rundown on the many benefits of prenatal exercise, as well as the guidelines for exactly how much we should aim for with how much effort. She busts common concerns and myths around prenatal exercise and brings us through the types of moves that help the pelvis prep best for birth. Let's dive in.
Welcome to Healthy as a Mother, the podcast for becoming and being a mother, with your co-hosts, Dr. Leah Gordon and Dr. Morgan McDermott, two naturopathic doctors who get it.
Each week, we teach you how to be the healthiest mother you can be, from fertility and preconception to pregnancy and birth prep, through postpartum and throughout motherhood, empowering you with the natural health guidance and education you're not getting elsewhere, so you can confidently navigate the broken system at large.
The real, the raw, the untalked about. And remember, this information is not intended to diagnose, treat, or manage any disease. Always consult with your doctor before making any changes.
The metabolic needs of pregnancy, postpartum healing, and making breast milk require more minerals than in other times of your life, and staying truly deeply hydrated during these times is very important. Nowadays, there are more options for this than ever, and ingredient quality and manufacturing integrity is very important for Dr. Leah and I. That's why we love Redmond Relight electrolyte powders. Mined in the USA, Relight contains Redmond's ancient unrefined sea salt with 60 plus trace minerals in addition to the appropriate proportions and forms of calcium, potassium, chloride, and magnesium that pregnant and breastfeeding moms need. Pregnancy demands a huge increase in blood volume and synthesis of an entire new baby, and that requires, you guessed it, minerals. This is the perfect blend to be sipping on during your labor or to have mixed into your bedside water bottle during breastfeeding. It tastes amazing, and my favorite flavors oscillate between mixed berry, strawberry lemonade, or lemon lime. Grab a sample pack option to try them yourself and use code HEALTHYMOTHER for 15% off your order of any of the products that Redmond has to offer, including their OG sea salt, other seasoning salts, natural toothpaste, bentonite clays, and more. Happy hydrating! Okay, welcome Gina Conley to the podcast today. Thank you for being here.
Thank you for having me.
And so for people that don't know who you are, you're sort of an imperative follow, I think, in this realm, in this world. If you're pregnant yourself, if you're training to become pregnant or trying to become pregnant, if you are in your postpartum time, if you're between kids, etc., your website, company, Instagram name is Mamastefit, like namaste, but also like Mama Stay Fit,
Yeah.
which I think is so smart. And all of your information will be linked in the show notes because you and your sister are such a wealth of knowledge on that platform, and there's so much free education, and it's inspiring. You have 4 little kids. She has 3. She's a midwife. You're a master's of exercise science and doula. You guys have such a good blend of sort of all of the angles of information for understanding how to optimize your health, your body, your physicality for birth, and then also to recover postpartum, but then how to train and be healthy in the exercise sphere during pregnancy, which is something that we get asked about a lot about on this podcast. And so this is why we're having you, because I think that it's best to hear from somebody who's really an expert in it. And I am not, so I'm not going to try to pretend like I am. And I want to sort of clarify some myths or give some guidelines too. I have my own preconceived notions about maybe what would be best of a timeline to stop doing certain things or what you could do, et cetera. But I think I'm probably a little bit more on the conservative end of things, and I'd love to hear your opinion. So I will ask those specific questions. But before we just dive into that, I want to give a little bit of a bio because I think you have a really cool background and a lot of programs to offer. So Gina Conley holds a Master of Science in Exercise Science and is the founder and CEO of Mamastefit, an industry-leading perinatal fitness provider with a training facility located in Aberdeen, North Carolina, so near the Fort Bragg area. Gina is a seasoned birth doula who has supported nearly 200 births in North Carolina, and you're the author of the book Training for Two, which is super cool, and that will also be in the show notes. Her unique experience of exclusively training perinatal fitness clients in person and online, coupled with supporting births as a doula, has resulted in the Mamastefit platform creating in-depth prenatal fitness programs which support clients recovering in postpartum to return to their desired sport or professional demands. Also, Gina is a 7-year Army veteran who served a combat tour in Afghanistan in support of operations Enduring Freedom and Freedom Sentinel. You are such a badass. There's so much there. So Before we begin, can you tell us a little bit about your book, Training for Two, and what viewers or listeners can expect to get out of that book and sort of the purpose of it?
So my book, Training for Two, is all about how you can have a strong pregnancy, a pain-free pregnancy, because pain is not a requirement of pregnancy. A lot of the physical issues that we have during pregnancy can be resolved with movement. And so we have like an entire chapter just on pain relief techniques for pregnancy. And it also is going to incorporate a lot on how you can prepare for birth, because a lot of the movements that we do during pregnancy, specifically with our prenatal fitness, can help to support improved mobility and movement when it comes to labor, because we don't want to figure out how to do a deep squat or how to do this labor position or how to create this space during labor. We want to do it during pregnancy. And so the book is going to incorporate a lot of exercises on what you can incorporate to help create space within your pelvis. So it's going to help you stay strong with different modifications throughout pregnancy. It incorporates modifications for like lifting exercises as well, in addition to more body weight exercises. It's going to incorporate how you can have a pain-free pregnancy with kind of solving a lot of these common ailments that folks have during their pregnancy. And then it's going to incorporate like a whole chapter on preparing for birth. How do you open the pelvis? What movements help to do that? And then there's a chapter on labor. What labor positions create that type of space within your pelvis? And then a very short chapter on like the early postpartum. What can you do after your baby is born to help support your healing long term? Because we don't have to wait until we're 6 weeks to begin to move our bodies, but we also don't want to like rush back to the gym either. So there's a whole chapter on how to kind of approach that like first month postpartum. So how to do pregnancy fitness. And it's going to be more than just walking. We have some reviews where folks are like, you have to be an athlete to do this book. You don't have to be an athlete. You just have to be willing to move your body. The book incorporates like full color photos. It has like just written descriptions on each exercise, in addition to QR codes to videos as well, because sometimes exercise is hard to like understand from just a picture. And so we have a QR code to like a YouTube video that explains this is how you do the movement. This is the sensation that you're seeking. This is how to kind of modify and tweak it so it can feel good for you, which has been a big hit with all of our readers as well. So yeah, this has been I had two babies born last year in 2024. I had my fourth child, Zoe, and then I had Training for Two that was born shortly after her. But yeah, so it was a labor of love, and I'm really glad it's out for the world now.
I am so impressed. I just have to say, I bow down at the fact that you have 4 children and you wrote a book
And a book
and you wrote
baby.
yeah, your book baby. So you have 5 children. I have just the amount of time and effort that it takes to create something like that as a resource for people to look back on. And then, you know, the video is so key, such a cool idea to have those QR codes in there. And then I love that it's comprehensive. It's during the pregnancy, there's leading up to the birth, during your actual birth, you know, maybe using all your doula knowledge, and then also all of the pelvic levels, which I know that we'll get into at some point in the episode today. It's such a there's nothing like it. So anyway, Training for Two will be in the show notes as well, so you guys can check that out. And then so let's start talking about it. I would love to have your sort of overview of what you recommend when it comes to prenatal fitness, and then we'll talk about some of the nuances there too, because I think a lot of people think I'm going to hurt the baby, I'm going to hurt my body, I shouldn't do these things. And then I think a lot of other people think it's fine, I've been training like this, I'll just continue to train as hard or in whatever way as I was beforehand throughout my entire pregnancy. And I feel like it's probably a marriage of both of those ideas. We need to like know that there is body changes with like relaxin hormone and different things happening so that we don't injure ourselves, but we also don't want to be couch potatoes. So, you know, how to find that middle ground and that blend.
I do feel like there are extremes. Like we have if you move your body, you're going to hurt your pregnancy, hurt your baby, you'll have a miscarriage, like all these bad things will happen, especially if it regards like lifting weights. Like if you do anything more than like breathe and like prenatal yoga, it's dangerous. But then you have the other side of the spectrum, which is like pregnancy is not a disability. Like I should be able to do everything that I can do just because I'm pregnant, like it's whatever. Like, so there's these like two like very far extremes. And it's confusing for the average like viewer or listener or person who is just trying to navigate their pregnancy on like, okay, well, what can I do? Like, obviously, like that seems pretty extreme to do everything like I did pre-pregnancy. Like, I think I saw one lady who climbed Mount Everest like during her pregnancy, and I'm like, that seems extreme.
Yeah.
And then you have the other side, which is like, if you do anything, like you're going to hurt your baby. And so let's start with like kind of what are like the main like misconceptions of prenatal fitness, and then we'll kind of hone in on what is actually like really helpful for you to be doing. And so the two main concerns that folks usually have when it comes to prenatal fitness is it going to affect my pregnancy length? So will I have a miscarriage? Will I go into preterm labor? And is it going to affect my baby's development or their growth? Is it going to make them too small? Like, is it going to cause a complication for my baby? And so the answer to both of those is no. Prenatal fitness, if you're a low risk person, so if you don't have any like pre-existing conditions, or your provider hasn't specifically told you that exercise is contraindicated or not safe for you to do, the majority of us, exercise is very safe to do, and it doesn't increase your risk of miscarriage. Most miscarriages are due to chromosomal abnormalities, so really nothing that we could have done to cause it, and then unfortunately nothing that we could have really done to prevent it. And now obviously there's some additional health things that we can be doing to kind of optimize like our health during our preconception phase to support a healthy pregnancy. But if you're having a miscarriage, it's really not your fault. Like, lifting that weight or going for that run or doing that ab workout did not cause your miscarriage by any means. When it comes to preterm labor, one of the things that sometimes is prescribed to do if you have preterm labor, or if you have a complication at the end of your pregnancy, is bed rest, which is a little bit outdated. But essentially it's like, well, if the solution to preterm labor is to not exercise, then exercise must make that worse. And so maybe exercise causes preterm labor, when that's not necessarily true. And so exercising even into the late part of your pregnancy does not cause you to go into labor. Otherwise, I would not go until 41 weeks for most of my pregnancies. So exercise and movement does not put you into labor. It can help to support an easier labor process. It can help to support your baby's position, but it is not going to put you into labor. So all of the curb walking and the mile circuits and all of the bouncing aggressively on a birth ball will not put you into labor by any means. So we can go ahead and understand that myth is incorrect, or that misconception is not true. Like, exercise does not affect the length of your pregnancy in a negative way. And this is supported by a lot of research studies, like meta-analysis, like very large like viewings of lots and lots of different studies. Find that it's very safe to be able to do it, and actually incredibly beneficial both for you and for your baby. The second concern is this going to impact my baby's development? Like, is this going to make my baby too small? Is my muscle going to suck away all of the nutrients and only go to my baby, or go to my muscles instead of to my baby? Our body is really good at compensating for itself. And so it will take what it needs for the baby, and your bones will just be more brittle, or baby's going to get what baby needs. But just because you're exercising doesn't mean that your body is necessarily taking it from the baby, or that's negatively impacting it. If anything, it's giving baby this controlled stimulus and this controlled stress, which helps to result in a baby that responds to stress. They have more resiliency to stress. They have an improved cognitive function. Their brain is more developed. Their nervous system is more developed, because they're getting all of this additional stimulus during pregnancy. They have higher blood volume. They look at babies like during labor, and they see that those babies are like responding to the stresses of labor better. They have higher APGAR scores, a little assessment after they're born. And so these babies from moms that are working out throughout their pregnancies are a little bit more developed when they're born. They have, again, that nervous system, cognitive development. And so that translates to improved language skills in the first year of life, improved motor skills, so gross and fine motor skills in the first year of life. And that just kind of goes on from there. And so we're kind of setting our babies up for success if we are exercising throughout a pregnancy. In addition, some of the concerns with, is this going to cause my baby to be too small? Like, is it going to negatively impact in that way? One of the things that could result in your baby being too small is IUGR. It's like intrauterine growth restriction. So the baby is too small. This is usually related to the placenta. And so if you exercise during your pregnancy, especially the first half, the key part of pregnancy where the placenta is developing, this tends to result in placenta that is more voluminous, that's larger, that has increased functional capacity, which means that we're probably not going to have those same complications with the placenta that can cause issues such as intrauterine growth restriction. So we may actually be preventing that by exercising during our pregnancy, because our placenta is kind of set up better to function in the later half of our pregnancy. Exercise is also going to reduce your complications or potential for complication during pregnancy, such as preeclampsia, gestational diabetes, hypertension, by like 30 to 40%. And it's a pretty substantial decrease. And if you do develop it, it's usually less severe. or it delays the onset of it. And so we're really only setting ourselves up by, excuse me, exercising throughout our pregnancy, because we're going to have a healthier pregnancy. This is going to reduce the need for potentially an induction due to a medical complication, which inductions tend to involve more interventions, which potentially could result in different birth outcomes or more complicated birth outcomes for us, or a more complicated labor, which could potentially be harder for us to heal from in the postpartum. So there's tons of benefits, not only for us during our pregnancy, but also tons of benefits for our baby. But the main concerns that folks have is this going to impact the length? Is this going to impact my baby? Is no, it's not. It's that if anything, it's going to be very positive for us to be able to do that. And so those are like the two main myths, and both of those are false. Like they're not necessarily true. And again, like I said before, if you do have like a pre-existing complication where exercise is contraindicated for you, if you have like a complication that develops during pregnancy, that is your provider saying, hey, exercise is not recommended for you. That's a different situation. Like at that point, the risk versus benefit does not outweigh itself. But if you are a low risk person, like nobody has told you that you can't exercise, we can exercise throughout our pregnancy. And ACOG even recommends it. These different governing bodies of obstetrics and midwifery all recommend exercising at least 150 minutes per week of moderate intensity. Like that's like 5 workouts a week for 30 minutes. And this is at a moderate intensity. So we're thinking like a 70 to 80% effort level. So this is like, we're breathing a little bit harder. Like that's a good effort level that we want to be accomplishing throughout the week. So it's not leisurely strolls. It's I'm going for a stroll, or I'm going for like a quick walk or a brisk walk, or I'm riding the Peloton and my heart rate's getting a little bit up. I can't speak like a full conversation easily, but I can get a few words out, like would be like a good kind of gauge to know it. We don't want to finish our workouts and be completely gassed and be completely like, I need to like lay down, like the world is spinning around me. Like that's a little bit too much. Like we're not trying to get like sweat angels, but we want to do more than just exist throughout our pregnancy. Like we can do more than just exist. And so that comes to, okay, well, what should I do? So the two extremes are do absolutely nothing and exist. And pregnancy is not a disability. I'm going to do everything. I'm going to climb Mount Everest and run marathons and do everything like super extreme, just like I did. But now I got a buddy with me. So we want to be somewhere in the middle. Like we don't want to be like, we don't want to just exist, because there are issues that come with not exercising at all throughout our pregnancies. Like again, we want to decrease our we want to reduce our risk of developing complications. We want to help to improve pelvic mobility. We want to be comfortable during our pregnancy. And then this is going to help to translate to a easier labor, hopefully. But we also don't want to just completely ignore the fact that we are pregnant and just go like ham with all of our workouts either. And so there is this happy medium that has to happen. You will have to modify at some point during your pregnancy. We may need to omit certain types of movements throughout our pregnancy. And so one of the things that we can think about when it comes to modifying is, one, we need to expand our identity beyond being an athlete. And so if you are from a very athletic background, this is where we tend to be on the extreme side of climbing Mount Everest. Like obviously not everybody is doing that, thankfully. But if you identify as an athlete, sometimes it's really hard to let go of the one thing that feels familiar to you. Like, well, I feel very different in my body. There's all these changes happening. So I'm going to hang on to the thing that feels very familiar to me, which is my workouts. Well, when we approach our workouts, we can think about, okay, well, what sensation am I looking for? Like, I want to strengthen this muscle. I want to feel this in my body. How can we do that in a shape that makes sense for us? So instead of seeking a specific shape, like I will do pull-ups, think about, okay, what sensation am I looking for with my pull-ups? I want to strengthen my back musculature in a vertical pulling motion. Okay, well, how can I do that is better serving my pregnant body? So at the beginning of your pregnancy, you can totally do pull-ups, like go for it. And then there's going to be a point where maybe pull-ups are causing a lot of abdominal coning. So we're starting to be symptomatic with our workouts. And so what abdominal coning is, for those that don't know what that is, it's when the center of your abdomen pushes out a lot further than the rest of the abdominal wall. So the tissue between your two six-pack ab muscles gets thinner and stretches during pregnancy to accommodate for our baby's growth. This is known as diastasis. It's normal. It needs to happen. But when we have increased pressure within the abdominal cavity that pushes into that tissue, with every repetition, with every exercise that you do, it's potentially damaging it a little bit more than normal. And so then it can be more complicated to heal in the postpartum. So when we're approaching our workouts during pregnancy, we want to be paying attention to the symptoms that we are feeling and the sensations within our body. And for a lot of athletes, we're used to ignoring what our body is communicating with us. We actually don't have great body awareness because we are like, excuse me, I am trying to work out, leave me alone. But during pregnancy, we have to really pay attention to how we are feeling within our body. So if you're experiencing the coning with your exercise, if you're experiencing a lot of pelvic floor heaviness, maybe you're leaking with your workouts, these are all signs that we maybe need to adjust the shape of the exercise that we're doing and focus more on the sensation. So from pull-ups, maybe we're experiencing a lot of coning. Maybe you're pressing weight overhead and you're experiencing coning and heaviness in the pelvic floor. Well, what can we do that achieves the same goal but looks different? So maybe we do lat pull down instead. Maybe we do banded pull downs instead. Instead of an overhead press from a standing position, maybe we find a seated position. Maybe we do an incline landmine press instead. And so we can change the shape while seeking that same sensation, which is going to better serve us during pregnancy. So we really want to pay attention to symptoms that we're feeling and adjust from there. And then trying to stay in that 70 to 80% range. With that extreme side of things, some of the myths are if you lift weights during your pregnancy, if you do CrossFit, you're going to have a C-section because your pelvic floor is going to be so tight, it's not going to be able to release and open for your baby. And so with this, just simply touching a weight does not immediately make your pelvic floor tight. But if we are always doing the same movement pattern over and over and over again, it is going to kind of adjust the tension within our pelvic floor. And typically with more of these like weightlifting programs, everything is very in the front to back motion, like movement plane. So the sagittal plane where we have our squats, our deadlifts, running, everything is front to back. And so this really emphasizes a lot of external hip rotation, a lot of spinal extension, because these are power positions. This is how we generate power. But if we're always doing only those movements, which is pretty common in like a standard CrossFit workout and a standard weightlifting workout, this is going to kind of change that tension within that pelvic floor, kind of like affect our hip mobility, our pelvic mobility. And so we're going to have a very more tight back half of our pelvic floor. The front half is going to have more length to it. The sacral mobility is going to be impacted. And so this is where we can start to see some issues when it comes to labor and baby's ability to pass through the pelvis. And so when we are lifting weights throughout pregnancy, or we're on that more athletic extreme side of things, and we're trying to figure out, okay, well, my pre-pregnancy workout is maybe not designed for pregnancy. How can I bring it more towards the middle? But I still want to do movements that I like. I want to still exercise in the way that I enjoy. Well, we need to think a little bit more about what type of movements that we include within our workouts. So one side is like just existing. We can move your body, find a movement that feels good for you. Like go for a walk, like a brisk walk, like not just a casual stroll, like, you know, get your blood flowing a little bit. If you're not familiar with exercise at all, on-demand videos, like join a gym, get a personal trainer, like on-demand videos, like there's so many on YouTube. Like we have a bunch on YouTube as well, but like a workout video that you follow is usually pretty accessible to most folks who are not as familiar with exercising. Now, if you're on the extreme side, we want to think about what sensation are we seeking, paying attention to symptoms that we're feeling, and actually modifying our movements. Like it's okay if your squat is not exactly the same as it was pre-pregnancy. It's okay if you're not PRing your squat every time you lift the bar. Like we need to expand our mind and be more than just an athlete and kind of figure out that middle point. But I can go over like specific movements that I would recommend, but yeah, I'll bring it back to you.
I love that. Thank you. You just said so much just then, and it was amazing. I feel like I just want to say from what you just said a second ago, this is not the season, right, for those PRs.
Yeah.
It's okay. And you can still work out, be healthy. I love the idea of changing the shape of it so that you're still achieving that, whatever it is for you that you love about it. That's so smart. And it's such a good way to do it where you're not necessarily completely stopping what you've loved this whole time. And there really is such an identifying piece to this too. If you have this practice in your life where 5-6 days a week you're going and working out, you've done this for years, and then all of a sudden now you feel like you can't do it, shouldn't do it, there's misinformation, whatever, that's going to be a very, very, it's just one more thing on top of adjusting to all of new motherhood that doesn't necessarily need to be that way. And I had a pelvic floor physical therapist on the podcast. I'll put her episode in the show note links too. We were talking specifically about the CrossFit people or the people who love to lift weights. And she was saying that in terms of pelvic floor, which I love your specific example of the sagittal plane, like the front to back motions, and then how that can affect just, this pelvic floor imbalance to where it's tighter in the back and looser in the front, and how does that affect things. She was also saying that, you can come into a pelvic floor PT appointment, get assessed, and ensure that you're using your pelvic floor properly during your lifts. And if you are, then go for it. If you know what you are doing with it and you're doing it well, then that's awesome. Even accommodating the growing weight of a baby. And yeah, again, at some point it will have to change. You will have to make some accommodations. And I just really encourage people to lean into that, connection to your body. Like, when does it maybe not feel so good, or you're starting to see that your abs are doing the coning? And the reason why that is, I know you did touch on this a little bit, but just for people who are like, well, why do we care? Well, you care because, yes, while there is a general separation that has to happen to an extent, it's a widening to accommodate the size of the baby in your postpartum period. You want it to come back together. But if it's too thin and damaged, as you mentioned, when it's time for it to come back together, sometimes it doesn't. And then it now results in this thing called diastasis recti, or diastasis recti. There's lots of different ways people pronounce it. And it can lead to chronic pain issues in your back and incontinence and all sorts of different things, because the abdominal pressures now are off in a dysfunctional way. So there can be damage done, right, if we're doing things incorrectly, or completely ignoring our body signs and symptoms. So we don't want to be doing that. And I think and I love how you mentioned the idea that people have that they're going to either affect the length of their pregnancy or maybe the size of the baby. And then let's speak too also about, okay, hurting our bodies, right? Like with relaxin, which is a hormone that goes through the body as soon as you become pregnant, and it helps all of the muscles and tendons and joints and everything become loosey goosey and stretch a little bit better, and it relaxes, so that at the time of birth everything literally has to open up, and that you have that option there for this joint mobility that you wouldn't have had it in pregnancy. Now, where that can affect pregnant workouts and prenatal fitness would be if you are maybe doing something like I don't know, like a lunge potentially with too much weight, and you're really stretching some sort of joint, or you're opening up something. There could be some more pelvic sort of destabilization there. Or even with prenatal yoga, people will find this like newfound flexibility in their muscles as they're doing yoga, and they're like, wow, what is this? And then they'll lean into it maybe a little bit too much. So we just want to be don't push yourself to these extremes, but also know that there's so many benefits. And I had no idea there was that many benefits to the baby. I did not realize that it was, obviously I think about fetal optimal positioning. So meaning like your baby's in a good position for birth. And yes, your body has had all of this amazing blood flow, strength, and mobility in your pelvis throughout the entire pregnancy because you've been exercising. And now when it comes time for birth, you're going to be like rocking and ready to go. But I did not realize, and it makes sense epigenetically that there would be benefits, of course, to those like minor stressors on the baby. But that is fascinating that we have the actual research to show all of those different, from like fine motor skills and speech and all sorts of different things. But it makes sense because when we, even like, this is obviously once the puppies are born, but there are systems when you're breeding a dog and you have a litter of puppies that you can do this like neural stimulation test that kind of stresses the puppy. And it's only like 15 seconds. Yeah, but they do it like every day from day one on. And it's like, they put them on their back, they put them on their side, their head down. So it's like a little vestibular cochlear kind of, in their brain, cranial nerve activation, but then also they're like touching in between their pads of their paws, which are very sensitive. So they're getting a little neural stimulation that way, and then their ears, et cetera, et cetera. But it makes a puppy basically that is like so much, their brains are much more adaptable and have that higher stress tolerance than to be really good puppies, like to say, go to a family with children or something like that. And so it makes sense that our human babies would be better adapted to all of just general life when there is these stressors, especially the stress of birth. That is a really, really key thing because we always question why is it that some babies have these D cells, let's pretend it's outside of the situation of induction, or even if it is, but like, why do some babies handle that better than others? Birth is an inherently stressful event for a baby. It's also a completely natural physiological event for the baby, but there are going to be some that are going to handle it better than others. And it's just an interesting kind of thought experiment experience to think about. And then last thing I wanted to say was when I think about about the IUGR, so intrauterine growth restriction, having to do with the placenta, which is just the way that it is, right? And so the people that I think about, this is my like little small anecdotal, but I have some friends who are mega, mega, mega workout athletes, and they are teeny tiny, but they've made these humongous babies with these humongous placentas and humongous umbilical cords that have fed these gigantic babies throughout their whole pregnancy. And I'm like, wow, I wonder how much of that could have just been simply from this like very consistent, very strong presence in their life of their prenatal fitness and their, preconception fitness as well. It's just interesting, all of that to think about. And thank you also for the guideline of 150 minutes a week as the goal. So when people, I think, hear, oh, you should be working on pregnancy, and they're like, I don't know what that means.
Yeah. What do you mean?
Yeah, what do you mean? So that's a great one. And walking hills, walking stairs. Like sometimes people will act as though, oh, sit down, don't, rest your feet, you're pregnant, like you don't need to do anything, it's okay. And it just and this is where I do agree with that, right? Like pregnancy is not a disability unless you are on for some reason some kind of a bed rest, you have placenta previa, or you're just shortened cervix or something like that, whatever it is, twins. But we need to remember that what would we be doing way, way, way back in the day? We were still contributing to our community and, sitting in deep squats and walking long distances and carrying things and tending to other children. And it's not like we were stagnant. We were still up on our feet and doing a lot. And that's amazing. We just maybe don't need to push ourselves to the extreme of going to Mount Everest. Or like when I was in high school, our track coach's wife ran a marathon when she was like 8 months pregnant. And I do wonder about that. In your opinion, do you see women who maybe continue to push really hard, too hard, extremes, like continue to run the entire pregnancy, or maybe are lifting like, to a level that they probably shouldn't? Do you see negative effects on her body, potentially with pain or pubic symphysis dysfunction or prolapse later on, etc.?
Let's take a quick break to hear a word from our sponsors. Did you know that 97% of women in the US take a prenatal supplement, yet 95% plus are still deficient in key nutrients? My favorite prenatal is from a company called Needed because they dose nutrients at levels to not just meet the bare minimum as most prenatals do. They actually use form of nutrients and dosages that allow mama and baby to thrive. Needed actually approached me years ago and asked me if I could help them design the perfect prenatal because they knew that the current prenatals available were not actually helping women. We spent over 3 years diving into the research and understanding what practitioners are seeing and what women actually need at this important season before we formulated this amazingly supportive option. It's no wonder over 4,000 practitioners now recommend Needed, something I am very proud of. If you have followed me for a while, you know that prenatals and optimizing nutrients starts long before pregnancy, so no matter where you are along your fertility or motherhood journey, Needed is the brand I recommend. Head to thisisneeded.com and use code HEALTHYMOTHER to save 20% on your first order. Again, visit thisisneeded.com and use code HEALTHYMOTHER to save 20%. Okay, back to the show.
So I have a hard time believing that somebody who is like still pushing their bodies to the extreme during pregnancy is not experiencing symptoms. I have a really hard time believing that somebody is 9 months pregnant and they're running with the same biomechanical pattern that they did pre-pregnancy with no pain or discomfort. That's like really like a very far-fetched like concept to me. I'm sure there are people out there because we inherently always get somebody who gets really angry when we say running is maybe not optimal for all of pregnancy. Because it is such an identity thing for folks, similar to the CrossFit athlete. Like the athlete, like it's so ingrained into like an identity that it's hard to let go of. And it's hard to accept that maybe it's not going to be 100% exactly what it like was pre-pregnancy. And so when we think about like these really extreme activities that are going on, we have to think about like what our body requires in order to do those things well. So with running, we're bounding from leg to leg. There's a big postural shift that happens during pregnancy that this is going to impact your running. This is going to impact your lifting and your pressure management. So the way that like our body just kind of positions itself is going to be in a more extended position. We're going to have more external hip rotation, more external pelvic rotation that's happening. This is going to change the pressure distribution into our pelvic floor. We have more of a curvature in our lower lower spine. That's normal for us as women during pregnancy. So there's just this big biomechanical change that happens. Our center of gravity is more forward and upwards. And so the way that we stabilize is different during pregnancy. We have that relaxin within our joints. So more impact type activities is going to increase the type of movement that's happening within our joints as well, which could then increase our risk of injury. And so, like, I don't think that any of these activities are necessarily harmful for the baby by any means. Like, pushing yourself to an extreme, I don't think is harmful for your baby. I do feel like it is potentially harmful for you in an aspect where, like, you could potentially increase your risk of injury, but also make it probably harder for you to return to it in the postpartum timeframe as well, because you're really reinforcing like a poor movement pattern that has to be like relearned after birth. And so if you think about somebody who is running during pregnancy, especially like towards like the 9-month mark, I have a really hard time. And there are people out there who can do it, but the majority of folks are kind of like in this weird waddle thing. Like they're a little bit more bouncy up and down. They're kind of more swaying side to side, and just their general posture and movement pattern is different. They probably have a different like change in tension within the pelvic floor because of these biomechanical shifts as well. And so when we come to the postpartum timeframe, we may have more pelvic floor issues that are like a little bit harder to kind of recover from. We now have this really big biomechanical pattern that we've been reinforcing for the past 9 months that we have to kind of shift away from, so that we're not so bouncy. We're not like swaying from side to side so much. We become more efficient with our form, but this takes time. And so usually the folks that I find that like really were running hard throughout their whole pregnancy, maybe ignoring things that they were feeling in their body, usually rush back to running in the postpartum. And then they're like, well, I'm still leaking. I have all these pelvic floor issues. And like, it's a different season. Like we maybe need to do something a little bit different. This is controversial for folks that are runners, like, cause it is so ingrained into the identity. It's really hard to be told like, maybe we don't need to run a marathon at 9 months pregnant. Maybe we can do like walk runs. Like we run for 30 seconds and then we walk for a minute. Or maybe we emphasize low impact activities like the elliptical, running, swimming, or not running, biking, like stationary biking, like walking, like the opposite of the running. So we focus more on like low impact cardio. We're still achieving that same sensation. So we're changing the shape, but we're still achieving the same sensation, still reinforcing cardiovascular endurance. So in the postpartum timeframe, that is all still there for you. But now we don't have all these pelvic floor issues that we're kind of overcoming, these injuries that we potentially got from like running too much during pregnancy. And just like, it's just uncomfortable. Like I was a collegiate runner. I like competed like in national level. Like I was an ultra marathoner before I got pregnant. I tried to go running when I was like 12 weeks pregnant, when I didn't really have much of a belly, and it was really uncomfortable for me. Like somebody who was used to running like 20-mile like long runs, like, and so I'm like, I just have a hard time believing that the average just like recreational runner like is really comfortable for their whole pregnancy. Like I'm just going to call bullshit on it. I'm like, there's no way that you felt good doing that. When I was like 6 weeks postpartum, I was like, I'm going to go for a 2-mile run. And I felt like my like whole pelvic floor was going to fall out of my body. And so I have a hard time believing that somebody is like 4 weeks postpartum and they're running 5Ks and they feel good. I'm like, you don't feel good. Don't lie to the rest of us. Like there's no way that you feel good.
I can barely dance when I have a huge belly. Like I just even swishing side to side, and you feel the baby in your belly with the amniotic fluid just going like, vroom, vroom,
I mean, it's just this like this. I mean, I have a small chest in general. Like I don't have very large boobs even when I'm breastfeeding, but like it's like running without a sports bra. Like that hurts. Like I'm just like, there's no way that feels good on your uterine ligaments. There's no way that like weird waddle thing that you got going is like beneficial for you. So yeah, I personally think that running is not the best pregnancy exercise. If somebody wants to do it and they make a decision to, I'm not going to be like, why? Like I'll just like, you're an adult, you can make whatever decisions work for you. I would say switching to low impact cardio activities so that we still get that cardiovascular strengthening and endurance, but we're doing it in a way that's more supportive of our pregnant body. And then it's the same thing when it comes to lifting weights. Like the amount of pressure that we need to stabilize our spine with really heavy lifts exceeds what we can create during pregnancy because of these postural changes, because of the center of gravity shift. So we stabilize differently. Our abdomen is also significantly more stretched. So the way that we manage pressure and intra-abdominal pressure is going to be very different during pregnancy. So we do not have the capability to safely lift at very high intensities, like the 90% and higher. Like that's just not realistic during pregnancy. So if you are doing very heavy lifts during pregnancy, especially towards the later half of it. And this is not to say that you can't lift heavy during pregnancy. I'm talking about like maximal efforts, like 1 to 2 reps at like 90%, like you're bailing the bar. You cannot generate the pressure that you need to safely do that without negatively impacting your pelvic floor, without potentially causing injury, without needing to bail. And those are just like not necessary during pregnancy to me. Like,
No.
and again, if we're doing these lifts and we have like these Olympic lifts, for example, like your belly is in the bar path, you have to alter the movement pattern in order to safely do it. And you will alter the movement pattern. And so now in the postpartum, you're trying to relearn how to clean and snatch. But now you've been spending 9 months swinging that bar like 3 feet in front of you. Like, and then you're like, well, now I got to relearn how to lift again. And I'm like, yeah, like you could have just done dumbbells and kept the same movement pattern. Maybe it's not the barbell, but and you can still do the movement. It just looks a little different. And so,
It's just a few months. Like, it's not like
yeah,
it's 5 years out of your life. I mean, maybe just kinda relax a little bit into it and make these adjustments. I think that that's such a good thing to think about because these people probably can't wait to get back to it postpartum. So it's like, listen, you're going to make a bigger problem for yourself then than if you can just adjust now and not have to deal with any of these issues so that you can,
yeah.
go right back into it and not have to relearn. That's so smart.
And then another big thing when it comes to like the running and like doing activities that are like kind of beyond our stability, because things change during pregnancy, our ability to stabilize changes, is when we are not stable, our pelvic floor is going to clench in an attempt to stabilize. Like our glutes are going to clench in an attempt to stabilize. And so if you think about like when you're walking on a floor that's kind of slippery, you're not in a relaxed position. Your whole body is like tense, trying to stabilize. Like that's essentially what you can think about is happening during pregnancy when we're doing activities that we don't feel stable in. Like our body is clenching and tightening and trying to find a way to stabilize. It's really good at compensating. And so if we have this pelvic floor that we have just been neglecting our whole pregnancy because we just want to do all of the things, then we're going to have a very tight pelvic floor. There's going to be that uneven tension. It's going to impact how well our pelvis can move. And that is going to have a big impact on our labor as well. And I mean, I think most people are not active during their pregnancies, like they're on the more sedentary side. And there's being completely inactive is also going to impact the tension of your pelvic floor because you're probably stuck in positions all the time because you don't have the strength to maintain an upright position to be able to improve pelvic mobility. And so you're kind of like just kind of stuck in those positions as well, which is essentially the same thing as somebody who is kind of stuck in their movement habits from pre-pregnancy. Like they can't let go of the sport or the exercises that they like. Like they're the two ends of the spectrum are kind of result in the same thing. We have this pelvic floor that is incredibly tight. We have lack of pelvic mobility and hip mobility, which is going to impact not only how our baby can position itself, but also like how well we can create space within our pelvis, which for me, I feel like has a huge impact in how easy or smooth our labor process goes. Like if your baby is in a funky position and they're having a hard time getting into that optimal position, or your pelvis is you just don't have the movement capability to create that space, this is where we're going to see a lot of issues during labor. This is where you're going to have the result be your provider telling you your pelvis is too small for your baby. Like it's not because the pelvis is too small, it's that there was like a limitation in movement or the baby was not aligned properly to the pelvis, maybe due to a mobility restriction, maybe it was due to an intervention that you received, but I have a hard time believing that people's pelvises are too small. I do firmly believe that like our movement patterns and habits during pregnancy can significantly impact not only our comfort throughout pregnancy, but also our labor experience. And that all definitely translates into the postpartum as well. If we go into our labor at a higher level of conditioning, there's going to be at least a month of deconditioning that happens postpartum just from resting and healing from the trauma that is birth.
Mm.
And then if we have a higher level of conditioning going into that, recovering postpartum is going to be easier. We have these familiar movement patterns. We have these familiar neurological connections. So we make it to the postpartum. These movements feel more familiar to us. They're easier for us to figure out. Like we still got to figure it out. Our body's a little bit different after we give birth, but it's not as challenging as I did absolutely nothing during my pregnancy, or I had these horrible movement patterns that I was constantly reinforcing because I couldn't let go of what I was doing. And so now I'm going to rush back into it. And so the two ends of the spectrum are not great to be at. Like we want to be Like, we want to connect with our body. We want to understand what our body is communicating to us, because that I know translates to labor. If you can feel the little nuances of your own labor, it really helps you to support your labor progress as well. So we want to be able to connect with our body, understand how it moves, understand what symptoms mean, what they're telling us, what, like, when we need to rest more, when we should push ourselves more. So yeah, there's like this fine balance when it comes to prenatal fitness, but we have to understand that there are a lot of changes that are happening within our body. It doesn't mean that we should do nothing, but we also can't do everything either.
So let's talk about the actual exercises that you would recommend. I mean, I don't know how you like to do this, but I guess what would be sort of like a good overview of things that you think are great if you could kind of like wave a magic wand that most pregnant women would be doing during their pregnancy?
So we have a whole fitness program that just does that for you, but this is like the general
And
structure of
we'll link
one
that.
of our workouts, which is going to kind of incorporate the things that we need to, one, have a comfortable pregnancy experience. Like, we don't have to be in pain and suffer throughout pregnancy. Like, a lot of like kind of the physical ailments that folks have can be resolved with movement, with exercise, with strengthening. And so I'm a big fan of strength training throughout pregnancy, because we have so much more movement happening within our pelvic joints, within all of our joints. And so I find extra, like, strength training tends to complement that really well, to help kind of reinforce some stability across the joints. So I have more of a preference towards resistance training. But if somebody doesn't want to lift super heavy weights, you don't have to. Resistance training is using bands, any sort of external resistance. It can be lighter weights, like dumbbells, for example. It doesn't have to be a super heavy barbell by any means. So I'm first going to recommend that somebody incorporate some sort of resistance training into their prenatal workout routine, because it helps to kind of offset the increased laxity and movement that's happening within all of our joints within our body, not just our pelvic joints. The next thing that I'm going to recommend that somebody incorporate within their workout routine is also going to be some sort of aerobic exercise. So walking, like low impact like exercise options or cardio options, such as like riding a stationary bicycle, like walking on a treadmill, walking outside. I'm going to recommend all of that as well, because aerobic training is also really beneficial for us during pregnancy. So those are kind of like the
What about a
two.
rower? What do you
A
think of
rower would
rowing?
be fine too. Yeah, that would
Yeah.
be fine. With the rower though, when we lean back too much, that's usually when I see more coning in our athletes. So we do want to kind of, as we get towards like the second half of pregnancy, just when we row and we come back, we're not like leaning all the way back. We're a little bit more upright with it. So we kind of maintain an upright position throughout, because then that doesn't strain the abdominals. But rowing would be a great like low impact like cardio exercise as well. When it comes to like specific movements that I would incorporate into our prenatal routine, I'm going to be thinking about, okay, what do I need my pelvis to be able to do during labor to help support creating space within each pelvic level to supporting my baby's position? And so there's four different movements that we need to be incorporating within our hips. The first is going to be external hip rotation. So toes, we pointed out, knees a little bit wider. This tends to create more space towards the top half of our pelvis. So we're creating more space kind of side to side in the top half of our pelvis. In addition to hip movement, we also need spinal movement. Our rib cage positioning influences how our pelvis can open, the tension within our pelvic floor. And so we also need like front to back spinal mobility to help create space in the top of the pelvis.
Wait. What do you mean the rib cage positioning affects the pelvic? What do you mean?
So if I am in a more extended spine position, so my rib cage is more flared, this is going to cause my pelvis to also tilt more forward as well. So I'm going to be in a more extended pelvic position, which is going to impact how I can kind of move my hips around as well. So if I'm in a more extended spine position, external hip rotation is much easier to do. But if I try to internally rotate my legs, so I try to bring my knees together and my ankles a little bit further, I'm going to feel a little bit more strain in the lower back. So how my rib cage is oriented is going to impact how I can position my pelvis as well. So nothing is in isolation, essentially. So when it comes to the top of the pelvis, we want to think about front to back spinal mobility, because we need both spinal extension and more like rounding in the back, so more of that anterior tilt, more of that posterior tilt, because that's going to help to create space in the top part of the pelvis. So more of that anterior tilt or more of the arching is creating a little bit more space to the front half of our pelvic inlet, while more of a tucked position is creating more space to the back part of the inlet.
So
And then the external rotation is creating more space side to side.
is this like literally like cat cows, or what are we
Yeah,
thinking
yeah,
of?
like cat cows. So wider legs, so external hip rotation exercises. So like squats are going to be like a big one for that. Anything where the knees are a little bit wider. So if you're doing cat cows, knees are wider as you do your pelvic tilts, for example. So that'll be like kind of the movement pattern that I'm thinking about for the top of the pelvis. External hip rotation on both sides, and then also incorporating some sort of spinal mobility front to back. When it
Okay.
comes to the middle of the pelvis, this is where we have more diagonal movement that's happening. So baby is now rotating through this pelvic space. And so we're kind of like shifting our weight from leg to leg. Everything's very asymmetrical. Everything's very side to side. And so we have this kind of like diagonal opening that's happening within the pelvis. And I just happen to have a pelvis right here.
Perfect.
So with the middle of the pelvis, we have like this diagonal movement that's happening, which is going to help your baby rotate through. So for the upper part of the middle of the pelvis, we want more external hip rotation or like open hip positions on one side. So one hip is a little bit more forward. We're thinking like the knee is moving away, almost like a Captain Morgan type pose. This is going to help to create space in the upper mid pelvis to help your baby begin to rotate. So we're thinking like Cossack lunges, like elevated lunges with the legs wide, like open hip type position. So what you like if you were doing yoga, like warrior poses where you're in this more open hip position, so you're feeling more of a stretch kind of in like the groin area. Those would be like upper mid pelvis openers, and that's going to help your baby begin to rotate. And fun fact, if your baby's in a funky position, if you're familiar with the Miles circuit where you do that like extend like exaggerated side lying and the elevated lunge, they're both upper mid pelvis openers because that's what's helping that baby rotate into the pelvis. So if you're doing that movement towards the end of pregnancy and you're like, why is this the movement? You can kind of enhance it a little bit by ensuring that you feel that groin stretch on that left side because that's what's helping the baby rotate because it's creating that pelvic space for them. When it
This is
comes,
wild. Really quick, I just have to stop you. This is so crazy to think because I think a lot of people, and we discussed this in other episodes too, but I think a lot of people think that during birth, the baby is just being like squeezed and crushed down by contraction strength, kind of like toothpaste out of a tube or whatever. And it's just not that way. It's like they are, one of those those balls where you're putting like the round peg in the round hole
yeah,
and then the square peg in the square hole. Or actually, Love Every just came out with, or whatever, for my daughter, they sent us one that was like, you have to kind of shift the pegs
yeah,
down and the shape changes. And it's hard to do. And it's like the baby is rotating, left, right, whatever it is, as they go down. And this is why you're talking, just to clarify for people that are like, why are you talking about different heights of the pelvis? It's because as they're going down, there's different things that they need to be able to do. And so this is why all of these motions are important. And you're talking about this in prenatal exercise. You can also be doing these things during birth, but the reason why they're important to do in prenatal exercise is because if your pelvis is not used to this, like these little micro moments of being able to stretch it further and further during your pregnancy is going to bring more blood flow. Your fascia will be healthier, your cartilage and your musculature and everything will be ready and primed and plump and good to go there, so that during the moment of actual birth, these motions are not like creaking open like cobwebs, like trying to
yeah.
do it. They've never been moved before during your pregnancy. Like it's going to be an easier motion. Your body has that muscle memory like you're talking about, but also all the entire pelvic bowl is more balanced and has this like functionality to it because it has been opened this particular way. And so the baby then now can do the motions that they need to do so that they don't, let's just pretend everybody's heard about like how difficult a birth can be if the baby is posterior, like so their occiput is posterior. And one of the things that can cause that, I mean, there's lots that can happen, but sometimes babies turn posterior because that is the way that it's easiest for them in that moment to navigate that, like where they're at in the pelvis. But ideally, we would have them be going the other direction. So it's OA, so occiput anterior. And as they're going down, we want to encourage these more easy to do, easy to birth, shorter, associated with shorter labor length positions. But also then it's just the whole thing is, yeah, faster, smoother, easier, less intervention needed. Babies less stressed because they're in the canal or in the pelvic bowl less time. You are not having to like work through this as hard as possible. There are ways to make our births easier, and we never know exactly what's going to happen during every single birth. So even if you've done your due diligence and it didn't end up working out for your birth outcome, it's not that all of that work was for naught. But we have to think that we're to give ourselves and our babies the best ability for it to work. There's a lot that we can do here. So okay, continue with your levels examples. I love it. I just wanted to pause and say that because I think a lot of people don't realize babies are moving so much during
Yeah,
birth.
and I do want to just touch on, like, if you're doing all this exercise during pregnancy and you don't have the outcome that you were hoping for, remembering that prenatal fitness is not just birth, it's also postpartum. Like, it's helping to support the postpartum. So we have clients that'll reach out to us about after, like, they've done our prenatal program and they had a C-section and they had an unexpected outcome to their birth. And they were like, it wasn't what I was expecting, but I feel really good postpartum. Like, I feel like I can do more than I feel like I should expect to be able to do because of my conditioning from the prenatal fitness. And so they're still thankful for the effort. Like, it's not just birth. But okay. So we have the top part of the pelvis, the inlets, opens more with external hip rotation. We're also thinking pelvic tilting. So we want that front to back pelvic movement. The upper mid pelvis is more of those open hip positions, but there's also some different orientations that are happening with the rib cage as well. So when we have a more open hip position, we're also going to be a little bit more flared on that side. So we're going to have a little bit more extension, and this is going to help you kind of get into that open hip position a little bit more. But now when we come to the bottom part of the pelvis or the lower mid pelvis, we want to think more like closed hip position. So if an open hip is kind of like a captain's Morgan, a closed hip position is like belly to thigh. So we're kind of shifting. If you think about, like, there's a pole in where your femur socket is, it's kind of like shifting that pelvis towards the pole. So belly is coming towards that thigh. And what's happening is we're kind of shifting that tailbone towards the side, and we're creating a little bit more space in here in this posterior portion of the pelvic floor. So with that closed hip position, so we have more of that internal hip or internal pelvic and hip rotation. We have a little bit more of a posterior tilt, so the pelvis is kind of tucking under on that side. And we have a little bit more compression. So that rib cage is coming down on that side. And that is what's helping us to create the space in the lower part of the pelvis to help our baby finish the rotation to get underneath this pubic bone. So for a lot of my clients, or not a lot of my clients that have issues where, like, they have a late labor stall, so 8 centimeters, and baby's just not coming down anymore, like they get kind of stuck there, or they've been pushing for a really long time, we get them into a hip shifted position, which is that closed hip position, and their babies rotate and then they're born, like, bam.
So give me
And
an
it's because we
example.
create that space. But it has to be something that's familiar to us. And then to finish up with the pelvis, the pelvic outlet where baby is born from, more internal hip rotation. So think like knees and ankles out, helps to create more space side to side. Lat tension can help to pull the sacrum backwards. So not necessarily arching in your back, but the lat musculature does not attach to your sacrum, but they attach to different fascial lines that attach to your sacrum. So if you've ever seen somebody laboring, like, they're always kind of pulling towards themselves, it's
Oh,
because that tension is helping to kind of like that traction is pulling the tailbone back and creating that space
whoa.
down there. So we're not arching in our backs by any means. We're not necessarily like coming into a big pelvic tilt, because I'll see some folks that, like, they take a spinning babies class or they like view some content on Instagram and they're like, oh, opening the top of the pelvis, wide knees, tucking the butt underneath, posterior pelvic tilt. Therefore, outlet must be internal hip rotation, arching in the back, and that's not necessarily true. And I'll sometimes message them and be like, hey, just to let you know. But anyways, regardless. So the top of the pelvis, wider legs, more of that front to back pelvic tilting, creating space in the front part and the back part of that inlet. Middle of the pelvis is going to be more of those asymmetrical movements, so open to closed hip positions. We're also thinking kind of this like lateral bending and rotation happening within the spine. And then for the bottom of the pelvis is more of the internal hip rotation, so knees and ankles out, creating more space in the bottom part of the pelvis. In addition to, we're coming back to that spinal tilt or spinal front to back type motion is again, usually specific to pushing more of a neutral position, just because we can generate more pressure in that position. But that's kind of like a nuance on its own. But when it comes to pregnancy, if we think about kind of like the biomechanical changes that are happening, a lot of us tend to favor a more extended spine position. So belly is kind of coming forward with more of that external hip rotation. So toes more pointed outwards. This is just like the normal movement pattern that we kind of shift into. And because of that, a lot of us tend to have tighter back musculature. So our lats are tighter, our hip flexors are a little bit tighter, and the back half of our pelvic floor is a little bit tighter. And if we don't do things to kind of come out of that, not necessarily to find neutral, but to improve our mobility, because I also see content out there that's like, if you don't sit in a neutral upright position at all times. Your baby's going to be OP and you'll have a C-section. I think I even saw one like very prominent page that was like very bold and saying, if you slouch, it equals C-sections, or slouching is the number one cause of C-sections. And I was like, please delete that. Please delete that. Slouching does not cause C-sections. But if we are always stuck in a position all the time, this is what's going to cause that lower back pain. This is what's going to impact our baby's position. This is what's going to impact that pelvic mobility. So we just want to increase movement. We want to ensure that we have the capability to like flex and extend our spine, laterally bend our spine, rotate our spine in each direction, that we can find external hip rotation, internal hip rotation, asymmetrical hip movements as well, and that those are accessible to us. They're familiar to us. So when it comes to labor, that movement capability is available, which is like a key component of prenatal fitness is how can I make the movements that I need for labor more familiar? And if we recognize that the most common postural tendency is going to be a more extended spine position with more external hip rotation, we need to ensure that our prenatal programs incorporate exercises that help us come into the opposite so that we can move from front to back. We can find external and internal hip rotation, not only getting stuck in one position. And so we need to incorporate exercises that release our lat musculature. So like any sort of like lat stretches are going to be really helpful. Exercises that release the hip flexors so that we can find that front to back mobility a little bit more easily. We need to incorporate exercises that involve hip shifted movements, which is kind of hard to explain. We have like a free birth prep circuit that includes all of these exercises within it. But essentially finding that closed hip position on one side to release that tension to the back half of the pelvic floor. And for a lot of our clients, I find that when they come into hip shifts, usually a lot of like the discomforts that they feel during pregnancy get resolved as well, because a lot of the issues that we're having relate to that uneven pelvic floor tension kind of impacting the pelvic position, impacting how well the surrounding musculature can work. So the movements that I would specifically focus on for prenatal fitness, like in addition to whatever your normal workout is based on common biomechanical patterns, is releasing my lats and hip flexors, and then finding closed hip positions with hip shifts. So if there's only one exercise that I can do, I would do hip shifted exercises to help release my pelvic floor, to support my comfort during pregnancy, and also to support my labor, because that's where a lot of folks have more tension within it. And we have tons of examples on like what a hip shift is, because it's hard for me to explain. But essentially it's finding belly more towards that thigh. So you're going to feel more of a stretch, kind of like where your jeans pockets would be, like on one side of your glute. And so we do a lot of demos on like Instagram with like a yoga block. You can do it standing, you can do it in side lying, but there's lots of variations of a hip shift, but essentially it's bringing that pelvis closer to the femur is what we're looking for.
Okay, sort of almost, is it like a twist? Is that wrong in thinking?
I guess I could just show you, and I know the viewer or listeners won't be able to see it, but essentially it's like bringing the belly towards the
Oh,
thigh, so we
okay.
have more of a stretch here in the glute.
Got it. Okay.
But you can
So a
do
little,
that in standing or all fours or side lying. There's lots of different variations to it. But if somebody's listening and they're like, I don't know what that is, just like go to Instagram and type in hip shift, like shifting a gear, and you'll see tons of examples, most likely. Like I can almost guarantee it. Or go to Google and type in what is a hip shift or Mamastefit hip shift, and you'll see tons of videos and stuff on it as well.
and then I'll put all of this information too in the show notes link. And so then, okay, before we close, I have one quick question, which is, what do you think about abdominal exercises in pregnancy? Like, do we avoid them? Are they just integrated in the movements because we should be having a little bit of like bracing and stabilization there? I mean, we're not doing crunches when we're pregnant, but or planks or something. But so, how do you explain that to people?
So we need to think about the core beyond just the ab muscles. Like the abs are like a part of our core system, and they have to work with other muscles in order to optimize pressure, to optimize stabilization. So we have to think about like what is the goal of our core? Our core canister is the anchor for our arms and legs to do things and to stabilize us. So it helps with spinal stability, it helps to manage pressure, and it helps to, again, for my arms and legs to do things to anchor onto something. And so if we think about that, then it makes it a little bit easier when it comes to figuring out what core exercises that we can do during pregnancy. Because you should absolutely still continue to train your core and your abdominals during pregnancy, but we have to think about like the function of it. And so we have different layers to our core. The deepest layer is going to be our deep core, which is going to include like the diaphragm, the pelvic floor, the internal obliques. It's going to include the transverse abdominis, or TAs is like a common way that you hear it, and then your multifidi along your spine. These are all going to help to manage and regulate pressure within your abdominal cavity, which is a key component of spinal stability. And there's also going to help with stability from spine to spine and help a lot with like postural control as well. So this is like our deep core. This is primarily going to be worked with diaphragmatic breathing, like how you breathe with your exercise is how we strengthen that deep core. The next layer is kind of like our global stabilization system. This layer is going to react based on the type of movement that we do. So our deep core is anticipatory. So it kind of turns on before movement happens. So if someone's throwing a ball at you, your deep core is going to turn on in anticipation of catching that ball. And then when you catch it, your next layer of core reacts to it. And so we need that like stable deep core so that it kind of sets up the foundation for the next layer of core to react to it. And this is where like your rectus abdominis, your external obliques, like your lat musculature, like all that kind of like QL muscles, like all of the kind of like the next layer, the aesthetically pleasing muscles like are at. This is your next layer of core, your reactive core. And so we can do a lot of dynamic movements, like where we're like doing a lot of like rotational movements, anti-movements, or resisting movement, really like a squat and a deadlift. Those are core exercises. We're resisting movement with our torso as we do this lift. You can also do like farmer's carry, bear crawls. Bear crawls tend to be a little bit less intensive on the core than like planks, but we're not doing a lot of like isometric holds. We're doing a lot of movement. It's a little bit easier to maintain our position like while we are like moving, as opposed to just holding a stationary posture. But we still can absolutely train our core. You can twist during pregnancy. I would highly recommend it. Again, like you said before, we're not finding like our deepest expression of a posture or of a twist, but we still need our spine to rotate. It's a functional component of our spine. If we never twist, it would cause more issues for you. It also, again, if you recall from like kind of what opens the pelvis, we need our spine to twist and rotate to create space in the middle of the pelvis. And so if you neglect twisting all of pregnancy because some yoga teacher told you it was dangerous and it was going to crush your placenta or something, like we're kind of setting you up, you've been set up for failure. We're not that you can fail birth, but like you're just not setting yourself up very well for an easier labor by neglecting twisting altogether. So we can still incorporate a lot of exercises into our prenatal routine that are focused on the core, but we need to think about what the function of the core is, which is to resist movement, to rotate, to support movement. And so we can do that with anti-movement. So anti-rotation, anti-extension, anti-flexion. So farmer's carry, bear crawls, Pallof presses. We can incorporate rotational movement. So like diagonal pull downs, upward chops, or like wood choppers, like sideways rotational exercises. I would say things like Russian twist or things that are very ab intensive, I would not recommend. So if you're noticing any coning with core exercises, this is probably not an optimal movement for you anymore. You're probably not able to manage pressure well. So I would omit it at that point. Some folks can do planks throughout their pregnancy. I would say that there's better exercises out there to train your core. But yeah, so I think you should absolutely train your core during pregnancy. It supports your baby's position. It helps to support your pushing. Like your core is very involved in pushing. It helps to support you healing in the postpartum. And so you should train it because it's where we anchor movement from. But we're not going to do sit-ups and crunches because aesthetically pleasing muscles do not equate function. They don't equate like healthier. It's just, they look good on a magazine, and most of the magazines are airbrushed and photoshopped anyways. Like it's all about the angles, the lighting. So yeah,
Yeah.
train your
And
core.
yeah, and not the goal during your pregnancy anyway. Nobody wants to have,
Yeah.
or nobody cares about the six pack on top of a pregnant belly, right?
Yeah,
So,
no.
okay, Gina, thank you so much for coming on, and you're just so much about this. I mean, it's like, I know it's your entire job, but it's so fun to hear you kind of just go off and riff and start going into your science brain and all of the different things that you love about this. And that's why your programs are so awesome too. So check out the show notes if you're interested. And definitely, I think following you guys on Instagram is a must. It's a must because just the inspiration that I see. I'm not somebody who loves to work out, who loves to lift weights. This is my year though. I'm going to start this year doing something in that realm. I used to a long time ago, but I'm like a go on a long walk kind of person. And it can be a hike, it can be with hills or something. I'm not afraid of the, heart rate increase or anything. I feel personally like I have no idea what I'm doing. in the gym and I don't want to get hurt. So I've sort of just avoided it, but this is my year to make that change because I can really tell. I mean, I'm 35 now and I can tell that I've lost so much muscle and I want to be strong. That's my goal, is to be strong, and also, thinking about age and bone density and just health in general and brain health and exercise, all of the different benefits, of course. So I will be checking out your things as well. Thank you so much for coming on, and I appreciate you.
Thank you for having me.
Are you pregnant or trying to conceive and looking for reliable, engaging education around how to have a healthy pregnancy and prepare for the future aspects of motherhood to come, like birth, breastfeeding, and postpartum? Look, I've got you. This is exactly the education you'll receive with my 6-week pregnancy call. You get access to my most comprehensive resource of everything that I wish women knew before heading into motherhood. It's a pregnancy health course, birth prep series, breastfeeding 101 course, and postpartum planning class, all in one. And for 6 straight weeks, we meet for an hour each week on Zoom with a small group of like-minded women going through it too, for you all to ask me questions and get clarity from a trusted expert. I can walk through it with you and hold your hand. The 6-week pregnancy call is only offered 4 times a year, so get on the wait list now. Head to milkmedicine.com for more information or click the link in the show notes. Thanks for listening to this episode of the Healthy as a Mother podcast. In order for others to hear this information, please leave a review with Apple Podcasts, subscribe, and send to a friend who could benefit from this content. We're so excited to share more on becoming and being a mother next time.
And please remember that the ideas and views of this podcast are for informational purposes only and are not intended to serve as a substitute for medical care of any kind, including the diagnosis or treatment of any illness or disease. Consult with your provider before integrating this information into your own care plan. And remember, a healthier future starts now, and it starts with you.